51 MCQ. A nurse is preparing to administer a chemotherapeutic agent via intraperitoneal therapy. In which position should the nurse plan to place the client before administering this therapy? The answer is B. Semi-Fowler's position. 52. निसंदेह या शब्दात कोणती संधी आहे? The answer is C. विसर्ग संधी. 53. In a certain code, gone is written as a 5139 and nodal is written as a 31268. How lodged written in that code language? The answer is A. 81259. A client with the hyperthyroidism is taking the lithium carbonate to inhibit the thyroid hormone release. With the complaints by the client should alert the nurse to a problem with the client's medication. The answer is B. The client complains of increased thirst and increase the urination. Out of the given words, only one is not spelled correctly. Find the word that is not correctly spelled. The answer is A. Apparently. A client is scheduled for an arteriogram using a radio-opaque dye. The nurse assesses which most critical item before the procedure. Allergy to iodine or shellfish. Answer D. 58 MCQ. FHS can be auscultated with a fetoscope as early as which of the following? The answer is D. 20 weeks of gestation. 59th. A nurse is caring for a client with the intracranial aneurysm. A nurse interprets that which of the following is related to dysfunction of cranial nerve 3. So answer is B. Ptosis of the left eyelid. या शब्दाचा शब्दप्रकार कोणता? आताचा शब्दप्रकार आन्सर बी. क्रिया विशेषण. 61. A home care nurse assesses an older client's functional status and ability to perform activities of daily living. A nurse focuses the assessment on. Answer is B. Self-care activities. 62. Which of the following post-operative diet is most appropriate for the client who has had a hydectomy? The answer is D. Clear liquid. 63. Out of the given options, choose the most appropriate one to fill in the blank. She has fought a constant battle. Answer is with depression throughout her career. 64. जर AB म्हणजे 3-4, BC म्हणजे 2-5 तर ABC काढा. The answer is 3:4:10. A option. 65. A nurse is providing the dietary teaching for a client with elevated cholesterol level. Which cooking oil is not suggested for the client on a low cholesterol diet? The answer is option C. Coconut oil. 66. A 6-month-old is hospitalized with the symptoms of botulism. What aspect of the infant's history is associated with the Clostridium botulism infection? The answer is B. Mother sweetens the infant's cereal with honey. 67th MCQ. Which of the following is not included in the definition of personality psychology? The answer is D. All of the above are included. 68. Nurse is caring for a client who is receiving the parenteral nutrition through a central venous catheter. Which action should the nurse plan to implement to decrease the risk of infection in this client? The answer is D. Use sterile technique for dressing changes. 69. महाराष्ट्र राज्याचे एकूण क्षेत्रफळ. टोटल एरिया ऑफ महाराष्ट्र स्टेट. आन्सर इज ए. 307713 किलोमीटर स्क्वेअर. 70. During the first 4 hours after a male circumcision, assessing for which of the following is the priority? The priority is checking the hemorrhage. Option B. 71. A client receiving a PAMET is admitted in hypertensive crisis. Which food is capable of producing a hypertensive crisis when taken with the medication? The answer is D. Cheddar cheese. 72. The nurse is caring for a client with the diagnosis of hepatitis who is experiencing the pruritus. Which would be the most appropriate nursing intervention? The answer is B. Add baby oil to the client's bathwater. 73. A client with the pancreatitis has been transferred to the intensive care unit. Which order should the nurse anticipate? Answer is B. Insertion of A living tube. 74 question. A client is being discharged to home while recovering from acute renal failure. The client indicates an understanding of the therapeutic dietary regimen. If the client state the need to eat food that are lower in, answer is C, potassium. The 75th MCQ. 75th MCQ. What will come in place of question mark in the following number series? The answer is B, 236.25. Thank you so much for watching. The remaining questions we will see in the next series.